So following the emergence of the new Omicron variant and the pending fourth wave, business for South Africa is calling for a rapid move to restrict access to public indoor areas that are not required for emergency use. So whether to get vaccinated against COVID-19 or not, this has been a hotly debated issue across the world. South Africa itself does not have a mandatory COVID-19 vaccination policy, but other vaccination certificates are required. For example, children going to school. To speak more about the ethical issues around mandatory COVID-19 vaccination for citizens, we're joined now by Professor Sylvester Chima, Associate Professor and Head Program of Bio and Research Ethics and Medical Law, College of Health Sciences at UKZN. A very good evening to you, and thank you so much for speaking to us. So perhaps let's just first start with mandatory vaccination as a policy. We'll get to whether it's ethical or not. Talk to us around the characteristics and how you'd go about implementing it.
Well, good evening to you and good evening to the viewers. The issue of mandatory vaccination is nothing new in public health, management of public health. For example, we all know that if you travel, for example, in countries that are endemic for yellow fever, for example, you might have to present a yellow fever vaccination card, which shows proof of immunization. Similarly, we also know that if you are a child who's headed for school, starting from kindergarten to some levels of primary school, you have to be immunized as by law, and that is mandatory immunization. And these are examples of how the process of immunization has been made mandatory in certain specific circumstances to prevent the spread of public health disease. Now, with regards to the issue of COVID, now this just happens to be a new virus which the world has been confronted with since 2020. And we're still trying to find ways, the effective ways, means of actually controlling it. As you can see, based on this interview we are having today, previously from 2020, we were confronted with a new virus for which there was no treatment, and the only available means of controlling it was social distancing, face mask, hand washing, which citizens were, somehow compelled to undertake. Eventually, late 2020, we got a vaccine, and then it was initially introduced with a single dose, and later on, there was a requirement that there has to be a double dose, and sometimes at this point, some people are recommending a booster dose. Now, as this vaccination scheme has been introduced, we've found out that there are occasional outbreaks, for example, the Omicron, which we have recently been confronted with. Yes.
Professor, I think the question now is, people are speaking about mandatory vaccination from the prism of being punitive. So when we weigh individual constitutional rights against the public interest, is it punitive?
That is why I gave you the example of mandatory vaccination for yellow fever, mandatory vaccination for children going to school, mandating vaccination for healthcare workers in certain areas to prevent infection to other people. So it is not, you cannot, because, we have now decided that maybe we need mandatory immunization in the case of COVID, since one dose or even multiple doses is not able to control it, then that cannot be considered punitive. And it's not against individual constitutional rights because it's in the best interest of the public. Now, when we talk about public health, we're always talking about the interest of the majority. What is in it will be in the best interest of the majority of the population is what needs to be done. Now, there will be individuals, just like any other immunization, who decide, well, I don't want yellow fever, I'm not traveling, or I don't want to send my children to school, I'll homeschool them because I don't want them to get immunized. But where you are involved with trying to have a public health method of controlling a spreading pandemic or infectious disease, one of the things that could be introduced would be mandatory immunization. Now, mandatory immunization doesn't mean that every single individual will be, conscripted and forced to take immunization. It's just that we will have to devise methods. For example, we can say if you're going to be a teacher and you are going to be in school, or if you're a student who's going to interact with other students in school, you must be immunized before you can go to school. We can say if, for example, if you have to go to church, some churches, we don't know, it's by choice, can give a mandatory, it is saying that, oh, people who have to use our church services or who have to attend our church must be immunized because they will infect other congregants. And those are examples of that. So in that case, it's not, we cannot consider it to be punitive or against the law or against constitutional rights.
I'd imagine, though, that there is an ultimate objective. Talk to us about international best practice, like the Syracuse principles, for instance, developed by the United Nations Economic and Social Council, where it is acceptable to so-called, quote-unquote, curtail human rights.
No, I wouldn't say it's curtailing human rights. And then I wouldn't say, what I'm saying is that, again, it extends to, in terms of international regulation. There's what we call international health regulations, IHR, which is mandates that all state actors, all countries must take some proactive action to prevent or the spread of public, of infectious disease from country to country. Now, one of those requirements would be, for example, to require that individuals who are moving from one area of the world to another area of the world will have the authorities in that area may require that they be, for example, immunized in order to protect the rest of the world. Well, that cannot be considered to be a curtailment of human rights because it impacts on everybody. In other words, whoever is traveling will be impacted on this. But if you don't want to be impacted on it, then you don't have to travel. That is the choice that you have.
Have we, as a country, done enough, for instance, in terms of ensuring there's adequate information, education, counselling, community engagement, and are we ensuring also the optimized use of the available resources within the expiration dates of some of these vaccines?
Now, as you well know, the government has done its level best to the point where you now have vaccines available on request. Now, the next thing is left for us as citizens, for example, to avail ourselves of these opportunities. Now, one of the things that the government can do is to reward those people who have, for example, taken the opportunity to get properly immunized by saying, you are free to go in certain areas. It's been done in France, and it's not only a South African thing. You are free to go, to go to restaurant. You are free to go to school. You're free to go to the hospital and things like that. Of course, hospital is an extreme example. What I'm just talking about in public spaces. You are free to do certain things as a reward and as a means of encouraging other people to also get immunized so that they can have access to those facilities. For example, you are free to go and watch football match if you are immunized. But if you are not immunized, then you have to stay at home and watch it on your own, or you stay. That is a way of encouraging other people to also get immunized. This is what the government can do, and they are doing it. And the next step to that, if people are not taking advantage of the opportunities given because vaccines are available, is for the government to then become stricter. For example, the government can require all public health or all public workers, for example, to get immunized before you can enter the workplace if you're a government employee. Universities can require all university employees and all students who are coming to the university to be immunized in order to protect the health of people in that particular space. So these are ways of encouraging. At the same time, it's called nudging, ethical nudging, to nudge people towards doing the right thing. That's the way we look at it.
Thank you so much for your time.